Well, if you haven't felt feverish with a sore throat and cough in the last week, chances are you know someone who has. Flu and flu-like illnesses are what's going around this week. Leslie Rohde reports more than half the state is reporting an increase in flu activity.
Patients must feel really bad to go to the ER with flu symptoms, but that's what's happening at Scott & White Healthcare in Round Rock.
It started off kind of late, kind of slow, but within the last week or so, we've been seeing a lot more people coming in with complaints of fever, cough, malaise, and sore throat.
Dr. Ross Tobelman says he hasn't seen as many flu patients this year as last, when H1N1 was feared, but there's definitely an uptick of flu right now. The Texas Department of State Health Services has positive flu tests now in Travis, Williamson, Hays, Bell, and Milam counties, with flu-like symptoms being reported in all surrounding counties. But Dr. Tobelman told us flu tests don't tell the whole story.
If you're under the age of 5, we can do rapid tests for flu, and they come back pretty quickly within within 30 minutes to an hour or so. But after the age of 5, a flu test is really non-diagnostic, meaning that there's a lot of times where you actually have the flu, but the test comes back negative anyway.
More people with flu symptoms are also going to the Heart Hospital of Austin's ER. Others are complaining of kidney stones and shortness of breath. Dr. Pat Crocker at Dell Children's Medical Center has treated patients for flu and RSV, a respiratory virus. And while he says Austin's flu numbers are at low levels, he expects them to keep rising, peaking around mid-January. The Texas Department of State Health Services website has a flu tracking page that is updated weekly, and it has a county-by-county breakdown of positive flu test results. You can find a link to that with this story on KXAN.com. Just look under the health section. Leslie Rohde, KXAN Austin News.